Welcome to today's talk session. My name is Deidre Moss, and I'm the host of Can We Talk? I'm an educator, motivator, and a talk connoisseur. For our session today, we will be talking about the Brazilian butt lift, or BBL for short. And in this collaborative session, we've invited Cherry Martinez of Sirena Surgical Services to help us dissect this topic. So at this time, I will pass the virtual mic to our guest so that she can introduce herself.
Hi, thank you, Zita, so much for having me here. I really appreciate you inviting us today. I am Cherry Martinez. I am the owner of Sirena Surgical Services. I have a mental health background. I'm a licensed therapist in the States. I'm a cancer survivor, and I am now a plastic surgery and reconstructive surgery coordinator, recovery house owner, and patient advocate.
Thank you so much for that introduction, Ms. Martinez. Before we begin, if you just join us, like and share this video, subscribe to our YouTube channel using the links on our page. We need your support to continue these talks. Also, if there's something you think we should be talking about, feel free to let us know. We want to hear from you. With that, let's begin our talk. So I know you briefly talk about yourself, Ms. Martinez. And so I just want you to tell us a little bit more about your background.
Well, I worked in the United States for many years as a patient advocate in many different environments in healthcare. We were focused a lot on just making sure that services were accessible and that people were happy with, the care that they were receiving in general. No matter the type of healthcare you're trying to receive, there typically is some type of a goal attached to it, right? So whether it be cardiology, weight loss, dietitian, diabetics, or plastic surgery, there's usually some type of goal that's attached. And so wanting to make sure that you're not just going to the doctor and paying money for copays and being pushed on a list and walking out without solutions, we actually want to make sure that people are getting what they need and that the services are accessible. And so I myself had plastic surgery after having some conditions happen in my own healthcare and wanting to just kind of have my outside match my inside. And ultimately what ended up happening was I had plastic surgery after helping many other people have plastic surgery. And I realized that there were a lot of gaps in the process that needed to be filled and needed to change. And so we kind of made the sacrifice and jumped on it to be out here full time and to assist those that are coming in search of, having their goals accomplished.
Yeah, well, I like that you said you kind of had the experience yourself. So you're not just talking from the seat of someone who never did it, but you actually had the experience yourself and you found the gap. You found the gap that needed to be filled. And so here you are, helping others achieve whatever goal it is that they want to achieve. You want to say what you had, or you?
Oh, yeah, sure. So I had a breast augmentation my very first round. And then my second round, I had a lipo and BBL procedure.
Oh, what's a lipo?
So lipo is liposuction, which is basically fat removal from different areas in your body. And once all of that fat is harvested, it's typically transferred into another area of your body. So very basic example would be liposuction happens in your abdomen or in your inner thighs to take fat out. And then if you want to have your butt filled up or if you want to have it expanded, you'd have that fat transferred. But it's really important that you pick a trained physician that knows how to do this stuff and that, you're really paying attention to who you're choosing because it can be a very dangerous procedure.
And you called the procedure light? You said light BBL?
No, lipo.
Oh, okay.
And BBL.
Okay. And so thank you for sharing your background. And like I said, you would have mentioned that you have the experience, so you went through the process, so you know where the gaps are. And for persons who, we hear about this term BBL, we hear about it, we see it on social media. But what is the BBL surgery?
So the BBL surgery basically is coined BBL because of the initial time when this procedure became popular. Initially, when the procedure became popular, it was coined BBL due to the Brazilian butt lift. It came out based on the booties that we were seeing in Rio, the booties that we were seeing at Carnival, the booties that we were seeing in certain Caribbean islands in certain costumes. And so it got coined BBL because that was the look people were going for. But in all actuality, BBL is nothing more than the fat transfer to something like your hip or butt area. If you are having a liposuction procedure, 9 times out of 10, the fat being removed has to either be put back in somewhere or it has to be discarded. And so in order for you to have a BBL surgery, we have to pull the fat from somewhere. You can't use artificial fat. You don't want to use butt fillers or butt injections or things that are synthetic. You want to use absolutely healthy tissue that is going to support your body, right? So what has to happen is typically you experience 360-degree lipo, which is anywhere from your armpit area all the way down to the underneath portion of your butt cheeks. And all of that is essentially lipo. They kind of poke through your entire body and harvest all the fat that they can. Using a metal cannula, it looks kind of like a large chapstick, and it has a little hole at the end of it. And that basically sucks all the fat out. That ends up in a jar during your surgery. It ends up kind of in a jar, and they harvest it. Once that's full, what they have there, they will pump it back into your body to give you definition. So let's say that you naturally have a larger size booty already, or you have a nice size booty that you're satisfied with, and you're like, I don't need it anymore back there. I'm okay. You want to look at yourself and consider, do I have dents? Do I have any kind of default? Do I have anything that needs perfecting? Do I have cellulite? Because sometimes it just takes an additional level of fat to cover all those lumps. And so although you may think, I don't want anything bigger, which in plastic surgery we call projection, you may want to improve a little defect or a little dimple. And that also, although it's uncommonly known, it is also considered the BBL. Because although you're not requiring your butt to be bigger, you are transferring fat into pockets in your booty, essentially, for a better appearance. And so that would be the fat transfer, AKA BBL surgery procedure.
Thank you. Thank you for explaining that, because I know a lot of persons, we see it, but we don't fully understand really what the surgery entails. And I just want to mention for those who may be watching, if you have any questions, please feel free to get your questions in. Ms. Martinez, is it okay for them to get their questions in?
Absolutely.
Oh, okay. Thank you so much. And if you see me just start my head down just a little bit, I'm going through the comments as well. But
and if
again,
for whatever reason, if you end up with guests that didn't catch the live stream and they have questions and you want to start some type of a thread somewhere that we can get back to this again, if people have questions and just catch the stream later, they don't have to feel like they missed their opportunity to ask. We definitely are available for whatever question. We'll provide you safety, security, making you just feel more comfortable and confident in what you're researching is not a problem.
Thank you. I appreciate that, because I know, people have questions, people are interested. Some women, they are interested in having the surgery, men and women, and they may have questions and they're doing their research. So thank you for being open and forthcoming about answering those questions. Thank you. I appreciate that. An awareness. Should women and men, know about this type of surgery? For the women and men who are contemplating it, what do they need to know? What should they know about the surgery before they go off and get the surgery done?
I think the first thing that I tell most of my clients or people that are prospective clients is that although this is elective surgery, and because we're choosing it, you should not confuse the fact that it's still very serious. And in fact, a lot more serious than other procedures that are absolutely necessary. So for example, a C-section is a very in-depth, very detailed, very serious and intrusive, right? I mean, absolutely intrusive and invasive procedure, right? We're actually going in your body and taking something out, and that has to happen, right? For some women, they have to have a C-section. Listen, people put a lot of fear and thought into that, but then when you think, oh, I'm gonna pick this surgery, they usually disassociate the dangers with it because it's something they're choosing. So they think that they can be careless with it or anything else. I definitely recommend that people understand what they're getting themselves into. Elective surgery is a wonderful, it can be a wonderful experience and it can create wonderful results, but you have to be prepared for what it actually is. It's not like somebody, tells you what you think it might be and you go into it blind. You really got to understand liposuction is the most, or one of the most, if not the most dangerous procedure in all of surgical procedures. And the BBL itself is one of the most deadly because it has been done by so many people who are untrained and are not doing it well, or just the wrong types of people are getting tools in their hands and are doing it for cheap. And so you want to be mindful that not everything that glitters is gold, but also not everything that's a bargain is a bargain. You want to keep in mind that, you know, you want to research your surgeons, make sure they have the appropriate certifications. And another thing that most people don't really realize is there's this big obsession with following trending surgeons, which is great. And you can follow trending surgeons, but I need you to pay attention to the facilities that they work in, because the facilities that they work in sometimes have government warnings issued to the facility. And if you're looking up the surgeon, you may not find the warning attached to the surgeon, because you've got to understand that, for a lack of better terms, the surgery centers here are almost like parking lots. Every doctor rents a space to see their patients, and then they shuffle the operating room. So nobody that works in the hospital actually works for your doctor. They have a maintenance staff usually that cleans, like in the hospital, and is in charge of the maintenance for the hospital. They usually have some nurses that round and kind of make sure that things are under control. But this is why you have to come to surgery with your own nurse, because the surgery centers here are not here to cater or to dedicate time to you. And so you want to be mindful of that. And if you have a doctor that could be renting out of facility A, and your doctor has a great reputation, has never had a problem, but facility A has CDC warnings, you know, by the Center for Disease Control from the United States, you want to be mindful of that. Because what does that mean? There's several facilities that have been highlighted over time for different things, and they've had the opportunity to correct themselves. Majority of them have. However, there are some facilities, there's one specific facility that has a lot of very popular surgeons, but they also have a CDC warning. And the warning that they have is for air infections, meaning that no matter how clean the surfaces are, you can get contaminated by the air quality. And so you're looking up your surgeon, and your surgeon is great and he's got a good record, but do you know that when he opens the instruments, they can be infected without him even intending to infect you? And most people don't realize, in order for the US government to highlight a specific clinic or a specific facility outside of the country, it takes a lot of reports of people coming back and actually reporting that specific facility for a US government entity to highlight somebody else. So imagine where you are, right? In the Bahamas, you have a small clinic that you can think of, maybe anyone, maybe where you get your own healthcare. The US government doesn't necessarily know that clinic because it's a small clinic in your neighborhood. For your clinic to get kind of shouted out on the beware, do not go specifically to this place, you have to consider that a bunch of people have gone back and gotten sick and reported, I got sick, but I went here. So there's a connection. But then also consider how many people don't report, how many people get sick and try to self-care and all those things. And so you want to be really mindful. You're picking a good surgeon, that you're familiar with the place that they're operating. You know if the place is safe. And not only that, surgery, like I tell all my patients, is not the end of your journey. It's not like, oh, we did it. It is the beginning. It is the very beginning, because your results are there, but they're not. If you don't get your massages, if you don't have proper aftercare, if you're not taking your antibiotics, if you're not drinking water, if, you know, all these things are going on and you're not doing your part, you're going to be swollen. You're going to get fibrosis. Your shape is not going to happen, you know, all this stuff. And
oh my goodness, you're going through some excellent points. I want you to, you're raising some excellent points. Could we please go over, because I don't want anybody to miss these great points that you're talking about. This is important. I just want to mention Julian. Thank you, Julian, for watching. I know we have others watching. If you have questions, please get your questions in. And I thank you for collaborating with us. I didn't mention where you were from, so I just want to highlight where you're from.
So I am born and raised in New York City, educated in New York. However, I live in Santo Domingo now in the Dominican Republic, because this has become one of the big havens for plastic surgery. And I had plastic surgery here, saw the gaps, knew the system, knew some surgeons from over the years of helping other family and friends. And I ended up here.
Thank you. Thank you so much. You mentioned some excellent points. You talked about the first one, and I remember you talk about people, they pull up the trending surgeons, but you mentioned that not only should you focus on, okay, the popular surgeon, but also knowing about the facility where you're going. That's key. That's important because you, whereas you're looking for the trending surgeon, by just searching, just for that person, you may bypass, okay, the facility that they work at. There may be some issues going on behind the scenes. So I want to thank you for mentioning that. That's very important because sometimes, we may see results from other persons and we may say, okay, this doctor did a great job. Let me see if I can pull this up, or I'm going to go with him. But what about the facility where he does the work at? Is that facility, is it up to standard? So thank you for mentioning that. And then you also talked about, oh my goodness, you mentioned this point, aftercare. It doesn't just end at surgery, but also, taking care of yourself and the different massages and different techniques that you need to maintain, what you get, because it could end in, you can end up getting some risk if you're not following up after surgery. So I want to thank you for mentioning that. So jump back in. You were mentioning some great points.
Another thing that is super important, since we're talking about lipo BBL procedures, I want you guys to understand, and I promise that I don't say this because I want to throw an additional procedure at you or because I want you to do something different than what you're hoping for. I have no agenda. My whole entire thing is about advocating for my patients and getting you the best possible for your money, for your time, everything. I don't want you to have to go under the knife 2 and 3 times. However, sometimes we see women that want to have liposuction. And I need you to understand what that looks like if your skin is not tight. I weigh 130 pounds. And because I had liposuction done prior or not with a tummy tuck, my skin, although you would think I'm skinny and you would think I'm small and you think you don't need any of that, I now need a tummy tuck because my skin is loose. And it wasn't loose before because it had some fat behind it supporting it. So if you think about women who have, I'm going to show you my belly. If you think about women who have bellies like this or maybe bigger, right? They have fat that is supporting the skin. So that's why the skin looks tight. But if you make a hole here and you, from the inside all at once, the skin starts to look bunchy. And it's not fat. It's literally just the skin accumulating. And so if you are any bigger than me, which as you can see, I'm not very big. If you are bigger than me, if you've had a pregnancy, if you've had weight gain and weight loss, if your skin is at anything where you can pinch and pull, you do not want to have a liposuction only procedure. Because what will end up happening is your belly is going to end up looking like a big old prune. Or you're going to have a bunch of rolls when you sit down that you never had, because you're going to say, I was big and I had, for example, I was big and I never had rolls. I never had rolls. I just had a belly. Now I have no belly, but I got all these rolls and I look like an old person. And so you're not going to be happy. So many times women who weigh over 130 pounds or who have had a pregnancy, multiple pregnancies, have had weight gain or weight loss, or realistically are over 40 because our body goes through changes, you're more than likely going to be recommended a tummy tuck with lipo and BBL because you are not going to get the results that you want with lipo only. And so it's very important that women understand why. Is there a way that I can upload a video? Can I, not a video, a picture? Can I attach a picture here for you to be able to show your audience? Okay, I'm trying to see how I can do it.
Definitely. Let me let you share. You should be able to, let me give you share.
I want to show you a picture so that you guys can have an idea of what I'm talking about.
Okay, you should be able to share.
Here goes, share content. It says only the host can share in this meeting.
Okay. Okay, go ahead.
Okay, let's see. There you go. Photos. Hold on 1 second. Because this is very important. And most of the time when I tell women about this, they say, oh, okay, I understand. But then when I show it to you, it's a very different story. So how do I send this now? Do you see it?
Yeah, it's up.
Okay, so this woman, as you can see, she was a little bit heavier before surgery, right? But if you notice, she doesn't have any rolls when you look at her belly beforehand.
Right.
She's got a little laxity in her belly button area, but all the fat that she has underneath the skin is supporting her skin to be smooth.
Wow.
Because she did not get a tummy tuck and she wore a faja, it literally forced and squeezed her skin back against her abdominal muscle, but it didn't squeeze smoothly or attractively, aesthetically. And so now, in order for this patient to correct this issue, she needs to have a tummy tuck. And unfortunately now, this patient has now spent God knows how much money on their first round, and now God knows how much on the second round to correct it, because that does not look good.
Wow. Are you able to put that back up again? Wow.
Yes. Let me put it back up for you. And so that's really, really impactful. And it's something that women want to understand, that this is very real. You know what I mean? So typically, so you can see, typically a tummy tuck, right, happens this way. It will happen from this portion of your belly and all of this. So for this patient, it would have been like this. Would have been like this and like this. So now everything from here, everything from there would have been pulled down. And because it would have been pulled down, she wouldn't have had that wrinkling, that bunching, and she would have gotten a brand new belly button. And it would have looked exactly like it looks above all that wrinkling. The reason for that, like I said, is because unfortunately, they did not do a tummy tuck. They did the liposuction. They pulled all the fat that supported that skin out. And now that's what she's left with after compression, after everything else.
Oh, wow. And I don't think, I'm glad that you're sharing this, because I think people sometimes can miss this and overlook this. So thank you so much for sharing it.
No, absolutely. And I think it's very important that people understand, because I find that sometimes women will ask me, hi, I want lipo BBL. And I'll say, sure, fill out the photos. And they'll send me the photographs. And I'm like, okay, well, unfortunately, we can. They're like, well, can I just do tummy tuck next time? No, mommy, no, you can't. I would tell you if you could. I get it. Like, I get it. You don't want to cut. You don't want this. You don't want that. But if you're going to sign up for this process and you want a certain result, you have to understand that sometimes it takes certain things. And sometimes it's not a 1, 2, 3 process. Sometimes it's not all done in one shot. I presently have a woman in my house who is a post-bariatric patient. I think she weighed something like 300, 340 pounds. She had bariatric surgery. She's lost over 150 pounds, 200 pounds. I think she's like 145 now. She looks amazing, but she had a lot of skin that was hanging. She wanted a lipo, tummy tuck, and BBL. When she got here, guess what? Her procedures changed 1,000%. Because although you want a lipo, tummy tuck, and BBL, what you really want, because you're not the professional, is the results that the lipo, tummy tuck, BBL give you. And so we need to tell you, hey, guess what? Look at this here. If I do this, this is going to look like this. It's not going to be good. We've got to do it like this, like this, like this, and then come back and do this and this and this. And so with this patient, she already knew in order for her to look the way she wants to look in March for her wedding, she had to have surgery now so that she can come back in December to do the second part of her surgery so that she can be ready for her wedding dress in March. And so some people don't want to hear that it can't all happen at one time. Sometimes people don't want to hear that, you know, they can't do their whole life over at once, but it's not safe. And so if you want to really have the results you desire, you've got to be willing to kind of go with the flow and stick to the plan.
Thank you for mentioning that piece you said, but it's not safe. And when you said it's not safe, you're referring to doing everything at once?
Yeah, so in terms of safety, the Public Health Board here has what they call recommendations. And the recommendations, like, they kind of let every surgeon gauge their patients and their environments, but they do have recommendations that are very strictly followed for the most part. They call them recommendations, but everybody's like, oh, they say no, so we don't do it, kind of thing. And basically what it is, you know, here in the Dominican Republic, we do not use general anesthesia, which is another key difference to surgeries that happen on mainland countries like United States and Canada. You know, you get knocked out and you're put to sleep for God knows how long. Here, it doesn't work that way. Here we use an epidural to put you to sleep, and we use sedating medication. So you're put to sleep pretty much with a sleeping pill, and then we numb your body right before you fall asleep, and you don't feel anything because you're knocked out and your body's numb. And right when we're wheeling you out of the operating room, your body is already starting to wake up. It's not, you don't have machines breathing for you. You don't need to be intubated. It's just like going to sleep. And so because of that, we do not like to keep you under anesthesia for more than 3.5 to 4 hours. Lipo, tummy tuck, BBL, breast lift, arm lift, thigh lift, all these things cannot be done in 3.5 hours safely. Not only that, the longer that you are under the knife, the more blood you lose. And one of the biggest values that we focus on here for plastic surgery is the hemoglobin level. And for those of your guests that don't know what the hemoglobin is, I want you to picture it as a piece of lint that floats through your body, floats through your blood, floats through your veins, right? And these little pieces of lint, they're like these microscopic, like little balls. And what they do is they literally soak up like a cotton ball or like a piece of lint that got wet. It soaks up the oxygen. And those little pieces of hemoglobin float through your body and bounce against your tissues. And that is how your blood and your tissues absorb oxygen from you. And so you have nothing but a whole lot of hemoglobin in your blood. And for surgery, we need it to be at a certain level. For some people, it's harder to get there than others. Like anemic people have a very hard time to get it there. So when we finally do cut you open and you're on the table and lipo's happening, things are being pulled out of your body, you're bleeding. You get cut, you're bleeding. Anytime you're bleeding, you're spilling your hemoglobin, which means you're spilling the oxygen that's already in your body, the oxygen that is there to feed the inside of your tissues. If you're gonna have a cut, something simple from here to here, you know that on this side and this side, you've now interrupted the veins or whatever because you cut it here. So it's harder for this to breathe. So if you don't have hemoglobin floating through here or enough, this starts to die. And that happens with your incisions. It happens when people get like aggressive lipo, if you have an unskilled surgeon, all of those things. So keeping in mind that the longer you stay under the knife, you're losing blood, you're losing oxygen, you're losing hemoglobin. It's not safe for your breathing. It's not safe to keep you under anesthesia. We try to keep away from that. And so the surgeons here will do as much as they can, but in that time frame. And they're not going to squeeze procedures in to kind of make it because it won't look good. A tummy tuck surgery alone takes at least 3 hours. With
So
the lipo.
when you, sorry, go ahead.
No, I was saying with the lipo and BBL, it takes about 3 hours anyway. So imagine now adding in a breast reduction and a lift.
Yeah, that's what I'm thinking. Because when you hear about a person saying, I'm going to have all these things done, and having you explain that, how could you have all those things done? Wow. Wow.
Which are red flags, because I think, like I was saying, you know, in my book, I talk about the emotions, and I talk about the emotions involved with planning surgery, but the emotions involved in anything, right? Whether it's your birthday, vacation, surgery, whatever it is, when you get excited about something, so much can pass by. Like so much can be skipped because you're so excited and you're so focused that you don't pay attention to the little things. And so instead of saying, oh my God, I found a doctor that'll do everything, Why don't you say to yourself, I've talked to 7 doctors and nobody does it. And then I found this one guy who will. Why does he do it versus everybody else that's saying no? And people get excited because they hear what they want to hear. Because remember, this is elective. You're choosing it. So they think that it's okay. But in reality, you got to know that even with elective procedures, there's guidelines and barriers to keeping you safe. And I promise my girls, I'll do everything I can to get you as much as I can safely, but I don't sell booty in a box. We don't do Happy Meals here. You know, I refuse to have you come here and get your booty beautiful and your body beautiful and send you home in a box to your family. It's not what we do here. So I try to make sure that, you know, we talk about it. I definitely counsel our patients as much as possible. But when you get here, we're going to go and sit down with the plastic surgeon. And at the end of the day, when we sit with the plastic surgeon and we tell them everything that you want, they already know, you know, because we've coded you. But now that we're in person, we're talking about it again, you know, I will express, because I blow up the spot all the time. You know, we'll be in front of the surgeon and I'm like, and I know you want to have everything done, but doc, I was telling her that if she does all of this, this and this and this and this and this is going to happen, or these are things that are going to be a problem. And then the doctor usually will be like, yes, she's right. And this and this. And I think it's better if we do this. And, you know, and so then they're like, but the truth of the matter is people don't realize that as opposed to some coordinators that what I like to call them professional appointment setters, they schedule you an appointment, they collect your deposit and they disappear versus me that when you get here, I go with you to the doctor, I make sure that your surgery happens, but then you're also staying in my surgery recovery home. And so, which means that when you come home after surgery, yeah, hell yeah, I'm very invested in what surgeon you had surgery with. I'm invested in who's taking care of you and all those things. Because when you come home, you catch an infection, if anything happens, one, I need good communication with your surgeon. I need to trust your surgeon and know who it is and know that you're not coming home with an infection. I need to know that if something happens, I can reach your surgeon immediately. You know what I mean? So know that, yeah, to some extent, I don't dictate where you go. And I work with 14 plastic surgeons. And then there's a bunch of other surgeons that I'll tell you, I don't quote for them because I can't quote for everybody, right? I can't work everywhere, but I do accept their patients. So you're welcome to stay. And then there are other surgeons that I will say, unfortunately, we don't work with them and we don't accept their patients at the recovery home. And the reason for that is just because of liability. There's several surgeons that are very popular for being associated with deaths, for example, and they're very popular, like they're very known and they have very known reputations for, you know, having lots of deaths under their belt and still being in practice. And when
how does that happen? How does that happen? If they have all these deaths under their belt, how are they still able to practice?
Usually money.
Wow, that's crazy.
You know, when that happens, I've gotten to the place where I don't try to change the wheel anymore. I just watch where my wheels go. And so I pay very close attention. I tell my girls all the time, look, you guys, I'm not here to make you or to convince you. I'm here to make you feel confident, not convinced. If you feel good about where we're going, great. If you find somebody else that makes you feel good and comfortable, great. Tell me who it is. As long as it's not somebody you kind of have blacklisted, you're welcome and we'll make it happen. And at the end of the day, when you come home, my job is to make sure that you get what you came for, no matter where you went, no matter what happens. Because as women, right, there is this unfortunate like culture around, if you didn't do what I told you and now you have a problem, I won't support you. You didn't do what I wanted you to do, or I told you that that wasn't your friend, or I told you don't go over there, or I told you that surgeon is that I told you to pick one of mine and you still go and you do what you want to do. And now you come home and I'm like, oh, well, I told you don't mess with that surgeon. We don't mess with him. So I don't know, I can't help you. No, at the end of the day, we're all privy to making a mistake or to making a choice. Or how many of us haven't met people, whether it be in relationships, in love, in work, in business, in anything, right? Where you thought that person was for you. They sold themselves for you, whether it was a man, a job, whatever, right? They convinced you that they were the one and you are like, woo, I got it, I won. You listen, your hairs are standing up, weeks are going by, you excited until the day they pull out on you and you see who they really are. You know what I mean? And so you got to understand, like, sometimes you come out here and you're so enamored by that. That was another thing I wanted to say about the followers and the trending and what's popular. Listen, you know, a lot of people use Photoshop for these photos. A lot of people buy followers. If you find a doctor and you're curious about them, look at them. Before you start contacting them, click on, especially if it's on Instagram, click on the button that says followers, not who they're following, who is following them. Because when you go to an Instagram page, you'll see 11, 12, 15,000, 112,000 followers. And you might think, ooh, that's a good surgeon, 110,000 followers, 98,000 followers, right? But then what you don't realize is they bought 35,000 followers for $40 online from an app. And there's 7,000 Indian men from Bangladesh that are following that page. And so you want to be mindful that, like, you can't just take all of this stuff at face value. The internet is a crazy place. You're going to find a lot of mix of information. You want to understand that this is medical tourism. Although it is medicine, although it is plastic surgery, they know you're coming out here because it's cheaper. They know you're coming out here with American money or with euro, which is worth more than the current value here. They know that you're not familiar with the culture, things like that. And so you want to make sure you're not being taken advantage of, which is very common because, again, they're making their livelihood off of the tourism. It just so happens to be medical. And so you want to really make sure that you're dealing with somebody trusted, somebody that is going to advocate for you, somebody that's going to tell you the truth no matter what it is. You know what I mean? And not judge you for your decisions. A lot of these coordinators only work with patients that work with their doctors, you know, and only work with patients that go to specific recovery homes and stuff like that. And, you know, at the end of the day, we all have a motivation for what we're going through, what we're doing. And you want to make sure that you get what you came for. It breaks my heart seeing all these women that came and don't make it home to their families, you know, because, I mean, I did it twice. You know what I mean? I did it twice. And I know, like, you want something, and no matter what people think of what it is that you want, and even if you're doing it for somebody else, you might be doing it for somebody else because seeing their reaction makes you feel some way. It's not for me to judge your motivation, but you have so much hope invested in this, and you're so vulnerable, and you've come so far, and saving money for a lot of us is not easy. And you get here and then are taken advantage of or not respected the way you should be and not sent home. You know what I mean? Like, it's a big thing. And so I think the most important thing is making sure that if you want to do this, that you need to know that it is possible. But it's like skydiving. You wouldn't do it without researching a good company. You wouldn't do it without making sure that all the parachutes work and the insurance work and the pilots got licenses, and you double, triple, and quadruple check everything. Because, you know, this is serious. Even though you choose it, it is very serious. And it can be life-changing. And that is why I do what I do even on the hard days, because it's not easy. And if you can think of anybody that's had surgery before or has been ever like really sick, had really bad COVID, just really been out of it, you know how frustrating it is to not be able to do for yourself and move around and feel yourself. And plastic surgery is pretty intense when it comes to pain, when it comes to recovery. Imagine, it's like doing the gym, a year and a half of the gym in 3 hours. Your body is completely being retrained and remolded. And so you're going to go through a lot. Lack of sleep messes with your mood, messes with all kinds of stuff. Your blood pressure messes with your mood, whether you're eating, not eating, whether you're sleeping, you know, the medications, all that stuff puts you through a lot. So you want to be in a good environment. You want to feel safe. You want to feel comfortable. You want to know that you're going to be okay. You know what I mean? So take the time, or like I tell my girls all the time, you know, work with a professional, even if get yourself somebody, because my girls don't stress. I tell them, don't stress, let me stress, because chances are that I've already stressed about this for somebody else and I know what to do. You finding yourself out here, not speaking the language, not really knowing what to do, you know, you become a target like anything else.
But you mentioned some very, very important points. I want to get to those points, but I just want to mention those persons in the comment, James. This is a powerful program. Thank you, James, for joining us. Real talk, they have to do it the right way, no shortcuts. Thank you, James. And this gives great explanation to why facilities here have a separate facility fee from the cost of the actual procedure. I don't know if you want to talk about that.
Sure. So
Yeah.
here it's a little bit different, but so basically it's different, but it's kind of the same. So in the States, there are additional fees and the same thing here. So remember, like I was telling you, the clinic rents out medical suites, basically rents out a bunch of doctor's offices. And then the people that rent the doctor's offices have the opportunity to use the operating room. And so what happens is they kind of sign up on a list and they get assigned by the clinic the space in the operating room, those slots. The operating room, they have to rent it because it's not their office. So that has a fee. There are assistants that have to participate that don't work every day because they're not in the office, but they have to be in the operating room, have to get paid. The anesthesiologist is not part of your doctor's office. It's a separate person who comes to deliver a service for a fee. And so that typically is included in the surgery cost, but all those things have to come out. And so here in the Dominican Republic, those fees typically are included in the surgery costs and the surgeon pays those out, but they will require you to pay for other things like additional evaluations. So the basic stuff that will be checked when you come for surgery is your regular blood work, a complete blood count. You'll also have chest x-rays to make sure your lungs are clear. And you'll have a cardiology examination, right? But that's the basic of what's offered and what's included, as well as the paying the surgery assistants, the fee for you to spend the night in the hospital, the fee for anesthesia, and the fee for your follow-up appointments. Outside of that, let's say if you're a woman of color, you might be a sickle cell trait carrier. You'll need to see hematology and have extra blood work done to make sure that you're healthy enough for surgery. That would be at your own expense. If you had COVID or if you're a smoker and you need to see pulmonology, which is not typically included in the surgery evaluation, then guess what? You'll be paying for that evaluation as well. Now, when you work with a coordinator or somebody that's experienced, they typically know to tell you, hey, you smoke, you know, you this, you that, you know, like I ask my girls, you smoke weed, you smoke hookah, you know, what are you doing? Are you drinking, blah, blah. Take these vitamins ahead of time. Like I tell them all those things that sometimes the doctor's office won't tell you. And so at least they know ahead of time, like, hey, I've got to stop smoking at this point, or I've got to stop doing these things, or I need to bring extra money for extra testing, because that happens a lot. You'll get here and they didn't tell you that you need a COVID test or you need something, and they're charging you extravagant amounts for basic testing, and you didn't know about it. But that will keep them from doing your surgery if you don't have everything that you need done.
Wow, thank you for sharing that. I made you host. Could you make me the host again, please? I'm so sorry. I know I did that when you shared if you can, you can put it
How?
Let me check right on the side of there should be a menu option there for you to do it on the side.
There it goes.
Thank you so much. Thank you, appreciate it. So I just want to get to the other comments as well. So
I came in because it's raining, so I moved.
Oh,
I'm gonna turn the light on.
Wow. I'm trying to adjust our video. I don't know why it's not allowing me to get both of us on the screen together like it normally should. Okay. So I also want to get to so we're back. Okay, good. So Julian is saying we need to have more dialogue about this topic. Ashley is saying very informative interview that needs to be shared. Knowledge is key. Thank you so much, Ashley, for joining us. Dylan is saying very informative. Julian is saying great interview. Thank you all for joining us today. We had to talk about this topic. This topic is very important. There are many women who are opting to have the surgery, and so especially women of color, right, Ms. Martinez, women of color, and we have
absolutely
we have women dying going through the process. So we thought that it's fitting to have this talk, and I hope that we can have maybe a part two, because I'm saying that it's impossible to get everything in this one session. We can't do it all in this one session. So if you
No,
can, I would love to have you back on to further dive into this topic.
absolutely. And I think if we could invite your girls, I mean, I think you and I can speak a little bit about it off air, but I have a girls trip that we put together every few months, and we invite women to come out to actually meet my surgeons. Like, most of the time the girls come for surgery and they want to go to the beach, they want to go out, but when you come for surgery, this is not the time to hang out. And so what we did was I put together a trip where girls come out, we stay in an all-inclusive hotel. I invite my top surgeons, and you guys get free consultations, free time to ask the surgeon any questions you want. You get to meet with all of my staff. You get to meet with my patients that have been here before. You get to learn about your experience, and you get to bond with other women on that trip who you may want to set a date with. Because maybe in your home community, you don't have anybody that can be supportive of you, or anybody that's gonna like cheer you on. They're like, girl, you don't need that, please. You need to pay them bills. You know what I mean? But if you have somebody that you meet on this trip and they're supportive of you, they understand your goals, they become surgery sisters with you. You can come out together, have surgery together, you know. And we have a wide network of support systems within Sirena Surgical. Like, we have private WhatsApp groups and surgery groups and stuff where we do online baby showers and all kinds of craziness, because our girls are connected on so much more than just a surgery level. The vulnerability, the trust, the support, it becomes a lot more than just when is your date and what are you getting done. And so, you know, we can talk more about bringing some of your girls out and you guys coming, and maybe we can even have like a round table there with you and me and some people, and really, really spend time educating these women on how to be able to achieve their goals, because so important that they know it is accessible. You don't need to be afraid. Media is going to try to get the best ratings that they can, and unfortunately it comes from traumatic situations. But we need to celebrate women of color. We need to celebrate ourselves and all of the accomplishments that we make for ourselves. Medicaid ain't paying for this. This is not a government paid, insurance paid procedure. Our women sweated for this, worked hard for this, sacrificed for this, their mothers, their daughters, their sisters, their workers, their wives. You know what I mean? And some of us are bound and broken, some of us are strong, and doesn't matter. We deserve to be honored, respected, and to be supported. And so we're here, and know that whatever we can do to partner with you guys, let us know. We're more than happy to do whatever we can to help.
Yeah, I love that. Thank you. Thank you so much. Thank you. I need to get the date of that trip. But I want to go to some comments. Dallas is saying, can you talk about men getting a tummy tuck, liposuction? He says, I'm 230 pounds with a belly. I was told I don't need it and that I should try to get the belly off myself.
A plastic surgeon didn't tell him that. So guidelines in general, you want to stay under a 40 BMI. You can easily calculate your BMI, which is your body mass index, online by having your height and your weight. I'm not sure how tall you are, so I can't calculate it off the rip of my head. But if you do it, you're probably somewhere within the 34 to 38 range, depending on how tall you are. And if that's the case, and that's fine. Men also consider getting tummy tucks and lipo. Some even come and get BBL. Honestly, why? And I'm not saying the gay men. I'm saying straight, burly, muscular, strong, straight men are getting BBLs as well. Because I'm sure that most of us have seen a man here or there that don't got no booty. They're big on top and they got no booty, or they got no hips or whatever. And some guys are like, I ain't got no butt, and they want some after whatever they get done. And so sometimes it's just done for an aesthetic and to improve their appearance. It's not always because they want a female looking butt. You know what I mean? So it definitely happens. I know my husband, for example, he's been waiting almost 2 years now for things to die down, and they just keep getting busier because he keeps saying, when things die down, I'll go do mine, because we're always talking about giving men that exposure, showing them that, you know, it happens and that it's okay. And not just, like I said, not just gay men do it, not just feminine men do it. Sometimes, I mean, look at these men now. They're getting hair, they're getting weaves and all kinds of glue on and whatever. This is permanent. This is healthy. This makes you healthier. It will help your heart, your weight, sleep apnea. I mean, there's so many benefits to it, but it's not a weight loss solution. So don't think you're gonna chop your belly off and then be sitting there with a bowl of biscuits and gravy, and don't think that it's not coming back, because it will.
So he's saying he's 5'7". He's saying he's 5'7".
Right now.
So James is saying, so the medical board doesn't regulate, or he's asking if the medical board regulates.
Do they regulate what?
James, you got to get back to that comment.
His BMI is a 36, and he qualifies for pretty much any surgeon across the board.
Okay. So Dallas, you hear that? You qualify for surgery across the board. Okay, so get it done. I mean, I prefer a guy with a flat butt, but hey, if you want that curve,
hey, whatever works.
But you know what? You mentioned so many good points. I know that it's going to be impossible to go through everything, and that's the thing. I don't want us to skip over these, because you touch on so. Oh my goodness! You said that you're the voice of reason, so you're going to be the one in that appointment room. You may, but you said shoot up the place, or you may throw it off, but you're going to have to get it out. You're going to have to say, okay, what about this, doctor? So you'll be at the appointment with your people, and you're going to be the voice of reason there. And that's important. You don't want to just have that yes person, because you talk about, right, persons coming over and you just have the people there just making appointments. They're consultant, but they're just basically there making appointments, but they're not really the ones to be the voice of reason to give you the information that you need. And so you would be the one there to kind of, get those questions in. So I want to thank you for mentioning that. There's so many different points that you brought up, and we're not going to get through it in this one session.
So we're recording a podcast with some patients this weekend, because we have a project happening with some Emmy award-winning executive producers for a documentary and a pilot that we're doing for some bigger networks. And we're actually going to be recording a podcast on Sunday. I would like to invite you to participate. It's at 3:00. Join us, and then what we get from there, we can bring it back to the girls here. But I'd like for you to be involved in that conversation. There will be some patients that have had surgery, patients that are coming, and then people that have never had surgery. And so I think it'll be a good opportunity for us to have a round table, and for you to even ask, as a person who is looking to advise a group of people, because you have a following, and get you there and be able to represent your people, because every demographic is different. And if you guys have questions, and like I said, if you put up a thread and people have questions, we can specifically target the questions that your demographic has, and we can answer those questions for you, for sure.
I love that. I would love to be a part of that. Just send me the info. I will be there. And we do have questions, coming from the Caribbean demographic. We have our questions. We have women from the Bahamas. They go over there and they want to have their surgery too. That's none of my business. You do what you got to do, but you want to do it the informative way. You want to be informed.
Right.
Yeah, you want to be informed. So LA Hasty, you're sending the eyes. LA, you have a question, LA? You just have the eyes here. What's the eyes about? But definitely, so I want to get to another question. I just want to ask you about recovery. That is an important point that you mentioned as well. Recovery is very important. So how should individuals prepare for recovery?
Well, there's a few things that people need to do when it comes to recovery. So the first thing is, whenever you decide that you're going to have surgery, you need to start drinking lots of water. Train your body to drink a lot of water. Doesn't matter if you're drinking juices. It doesn't matter if you're doing all kinds of other liquids. You need to drink water. You need to start creating a better type of consistency of fluid and flow in your body, and unclogging your pores and your glands so that you can drain that fluid appropriately. Second thing is, when it comes time for surgery, based on, the procedures you're going to be having, you want to make sure that you get the appropriate packing list, that you ask specific questions about what you're going to need, what you have included in your package and what you don't. Everybody includes something different. I personally create all-inclusive packages for my clients, so they don't have to really come with anything but the clothes on their back. We put everything together. They don't have to shop for their own supplies. They don't have to figure out if they're buying the right things. We try to do as much as we can in that aspect. And then, when you get to the recovery house, you want to definitely do your part. After the first day and a half, you don't want to be in bed. You need to be walking around. You need to promote your circulation and make sure that you're promoting drainage, that you're getting your massages. Anytime that you have any type of an injury or an incision or any type of surgical trauma, your body is going to respond with a self-defense mechanism, which is swelling. And usually that's filling the space between your tissue inside and your skin with fluid. And so, unfortunately, you're going to swell, right? But if you're not drinking water, you're never going to drain and the swelling's never going to come down. And that, unfortunately, is what causes you pain. And that fluid inside, because it's not just water, it's other fluids that were injected during the lipo. What ends up happening is that when that fluid gets old in your system, it becomes like Jello. So you know how when you put Jello in the fridge, it's nice and warm and it's liquidy and it looks like juice. But if you come back in 2 minutes and you shake it, it's already hard. And so that is essentially what fibrosis becomes over time. When that fluid becomes hardened, becomes stiff, and it can't come out, you now look like you've got pebbles under your skin. You've got hard masses of calcified fluid underneath your skin, which again cause pain and pressure, tension in areas, all kinds of stuff. So there's a lot of things, like I said, that you want to be mindful of. But the biggest thing is really learning about your procedure before you go for it. Make sure that people understand what you're getting yourself into, you know, and that you really protect yourself and prepare yourself for what it is that you're going to be involved in.
Thank you so much. So we're going to wind down, but we have to come back with a part 2 of this, if it's okay with you.
Absolutely.
I appreciate you so much. I just want to get to Dallas' comment. He's saying that, and I want to get your insight. He's saying, he mentioned that he wanted to have the surgery as a male, and he had a woman criticizing him for getting a tummy tuck as a male. So do you have any commentary as pertains to that?
Alfredo, what would you say if a woman criticized you because you wanted to have a lipo tummy tuck as a man?
It's my body.
He says it's his body. And
Okay.
so, you know, I think, no, honestly, I think culture is changing. Culture, he says he got criticized when he told some of his friends that he was considering doing it and stuff. People kind of like, what? But I think in general, it's like anything else, right? And one of the things that I was attributing some of the irresponsibility in the patients to is that if you think back 25 years, which is not that long ago and is still in our lifetime, right? If you think back 25 years, plastic surgery was a white woman in Hollywood thing. It was expensive. It was a white woman thing. It was a bougie woman celebrity thing. It was always hush hush. It wasn't very public, and it was, or thought to be, very, very pricey. It wasn't something that was accessible to our community. It wasn't something that women in our community were looking at, and even less men. I think we're moving into a culture in this day and age in general where men are becoming much more open with their feelings. Listen, 10 years ago, men weren't talking about oral sex, and now they're screaming about how they love it, right? People were denying that they did that 10 years ago, 12 years ago. I don't do that. I don't do that. I don't do that. Now, among men, they're like, what? You ain't a man if you don't do that. You understand? And so I think it becomes this thing where culture is changing and people are becoming more open. People are becoming more accepting. I mean, look at the whole LGBT movement. It started with 4 letters and there's like 12 now, right? And so I think it's just that, like, culture is opening up. People are starting to become more accepting. There are people that are not there yet, or people that maybe don't have as much exposure to it, or it's new ideas for them. But just because it's a new idea for them doesn't mean it should stop you from doing something that makes you feel good. Because at the end of the day, when you're running or going to play with your kids and you can't breathe, or when you're going to sleep at night and you got sleep apnea and you're choking on your throat because you can't breathe and your heart is racing and you wake up sweaty and your blood pressure is out of control, your girl who laughed at you yesterday about haha, what you think, you want to get a tummy tuck, is not feeling that. So there's real reasons why aesthetic and cosmetic surgery are valid and matter. And just because people don't understand that, that's on them. What I most of the time tell my patients is don't tell anybody until it's done. Keep it to yourself. Because even if somebody always was appreciating like the plastic surgery community, or if they were like in favor of plastic surgery and they wanted to do it and they can't do it and now you're doing it, they may not be as, you know, supportive for you, or they may not be as critical. They may be critical. There's a lot of reasons why people try to block you. I know a lot of times people say, don't go to the Dominican Republic, you're gonna die. Yeah, but then when you work with somebody like me, that in order to join my roster, you must be at least board certified in America as well as in the Dominican Republic. You can have 18 other certifications, but to work with me, you can't have any deaths on your roster. I need no infection outbreaks in the last 48 months. I also need to make sure that I stalk you for like 6 months before I start publishing you on my page. There's a lot of stuff that goes into it because, again, I'm not just a coordinator. I went through this and I know how much it matters. So I think there's all those little things make a difference. You know what I mean? I think all those things make a difference. And if you know what you want, don't worry about it.
Excellent points. Dallas is saying amen. Okay, Dallas, so you feeling that? Okay, Dallas. All right, do what you have to do, Dallas. Thank you so much. Thank you, LA. LA says she's here to learn. Thank you. And thank you for sharing with us today, Ms. Martinez. So we've arrived at a fast talk segment. You have about a minute to get through each of these questions. So here we go. What made you decide to become a consultant?
I had a horrible consultant. I had a horrible coordinator. I had a horrible second round. I was kicked out of my recovery home on the 3rd day after my medication was stolen and money was stolen from my locker. And when I reported it, I was asked to leave or that they were going to call the police on me. And as a result of that, I realized right then and there how dangerous it was, how much I'd been taken advantage of, how there was no respect for my recovery or my process or my vulnerability being a tourist. Here, the people who didn't really know me didn't know that I spoke the language or that I knew how to navigate. And I was thrown in the street with an IV pump in my arm. I was still very much post-operative. I was high on medications and no idea what was going on. And thank God I was able to get on my phone and Priceline.com myself to the nearest hotel. But if it wasn't for that savvy and that quick acting on my feet, I could have been robbed. I could have been abused. I could have went through a lot. Because again, you're a tourist standing on the street in a hospital gown with an IV in your arm and suitcases. You know, it's not a good look. So being that happened and I went through that, and like I said, I speak the language. My father was born in this country. It bothered me, and I felt like there's so many women coming from outside that are going to come here and they shouldn't have to go through this. And so
thank you.
Here I am.
Thank you. Do you think women of color are more disadvantaged as it pertains to BBL surgery, and why?
So I think they're more disadvantaged in terms of what?
When it comes to, as it pertains to BBL surgery, and why?
I don't think that they're more disadvantaged or at a higher ratio for any type of occurrence. However, what I do feel is that women of color lack the appropriate resources in general for certain thought processes and for acting on certain things. And so I find that my patients of color, for the most part, are the least prepared and need the most help in figuring out how to think about these things, how to look at these things. But again, if you think about our culture, many of us were under-resourced, didn't even have health insurance, didn't know how to get a referral for certain things, didn't know how to do certain things. And so I think when it comes to now an elective procedure, many times people don't know how to plan it.
Thank you. Why do you think BBL surgery is popular at this time? And do you think its popularity will decrease?
Absolutely. I think that to some extent, the popularity will decrease. I don't think that there's ever going to be a shortage of women wanting to have a nice silhouette and feeling comfortable with their body. But I think the boom of the big booty is already starting to show its decline. If you look at people like Jennifer Lopez, if you look at people like Kim Kardashian, you know, she was famous for her butt. And she always said her butt's not fake, her butt's not fake. Well, her butt wasn't fake. Her butt was real. It was her own fat. The problem is she'd had it transferred several times, so it was huge. And guess what? If you look at her now, she got less cakes than I do, and I don't got too much. You know what I mean? Now she had it taken down almost completely because it was too much. It's too much. And so now people are looking for a different look. And so now you're going to find that people are going to go for something else and something else will trend. But it'll come back around, just like bell bottoms in the 70s. We were wearing them when I was in school. And the other day, my daughter asked me for a pair. So I have no doubt that it'll come back around.
Thank you. What is one piece of advice you would give to an individual who's contemplating BBL surgery?
Really take time to sit with somebody and discuss the whole thing. Not just who can do my surgery, who's going to give me a good look, and what do I need to bring, what do I pay? But somebody that's really going to be invested in you, because this is a process. And while some of the transformation is outside, I don't know about you, but when you get your hair done and you get your makeup done, or when you feel that you look good, makes you feel good on the inside. And there's so many women that feel so strong and feel like they could, and they have this much doubt about getting certain things accomplished in their life. But when they have the surgery, I can't tell you how many women leave and they're like, oh, my man's never going to treat me like this again. And oh, I'm never going to feel like that again. Or I'm never going to tolerate this, because women finally feel like their outside matches their inside. And so they finally feel like they can push for certain things. You know what I mean? And a lot of times women leave and their boyfriends, within months, they break up with people, that things change, because so much of what they used to tolerate, they no longer going to tolerate. They weren't getting certain attention before. People didn't see them a certain way before. Now they see it on the outside, and they're getting the attention that they weren't getting before. And they realize that they deserve more. And so now things start to change. And so you want to be mindful that change in any way is not easy. Even if it's a change that you want, sometimes growing pains hurt. Going to the gym, anything that's not natural, right, hurts before it feels better, hurts to get the results you want. And so sometimes the change happens and you're not ready for it. You know, just like the changes and stuff you go through in your immediate post-op, with being tired, lack of sleep, pain, away from home, lonely, cranky, frustrated. So you want somebody that's genuinely going to be a support for you and not just try to push you into a surgery date. You know, really look at this as an overall experience. It's not just a surgery. There's so much more that's involved. And if you don't find somebody that's going to nurture all of that, chances are that it's going to be rough.
Thank you. Thank you so much for engaging in our Fast Talk segment. We're coming to the end. I know you have some things you may have to do, so we're going to wrap this up, but we're going to come back again to get through this topic. I just want to get through a few more last comments as we wrap this up. I want to get to Ashley's comment. She says she loves this discussion. She talked about having a high school friend who went to the DR and passed away there after having plastic surgery. She said that people who she worked with recommended a doctor in the DR to her, but she didn't know if she did her research, because the doctor that she went to was also known as Dr. Death. Do you have any comments for Ashley?
What I will say, because I personally don't comment on the surgeons, particularly if they're surgeons I don't work with. What I will say is that, unfortunately, earlier, there are some surgeons who have a more known reputation for being associated with deaths than others. As you mentioned, the surgeon you mentioned with the alias you mentioned has an alias for a reason. That has been something that's been around on social media for some time. I don't work with him. I don't really know, and I've never had experience with him, but I also stay away from things that seem to have been problematic. And so just, you know, my point is, if you know he has a nickname and you found out he had a nickname, if you might have Googled him beforehand, you might have found that. Don't be in such a rush to get the results that you want that you skip over some of the important pieces. Like I said, it's like anything else. Y'all know getting your hair done is crazy, right? You don't want to get your hair done just anywhere. You don't want just anybody putting a hot comb, passing a perm through your hair and burning you, right? Putting on your lace front and taking out with the glue, ripping your front.
Yep.
Better be really careful where you go. And so
exactly.
while there's a million salons and there could be 3 girls down the block that do hair in their apartment, it's the same thing like plastic surgery. There's a million people everywhere, but you got to make sure that whoever is there is making noise in a good way.
Yep, definitely. Thank you for commenting. And Ashley's saying she loves the fact that you are educating people on this matter, and also how to go about doing research and educating yourself about facilities and doctors. And these are the things that people should know. So thank you, Ashley, so much for listening in. Dallas is saying that comment had him grasping for air about the friend who would have lost their life. I know of women who have lost, in our communities, I've heard of women, they just decided to go off. I remember one recently, maybe about 2 years ago, she was supposed to get married, and she went off to get her surgery, and she never returned. And so this happens. I remember another lady, she went off, and she left behind 2 kids. She didn't return. She wanted to, get this makeover, I guess, after having her kids, and she didn't return. So it happens. This is a reality. And so this is why it's so important to talk about this topic. And this is why it's so important to have people like you who have walked that road, who has the experience of not only, you said you went back twice. So you have the experience of doing it yourself. And so where the gaps, you mentioned the gaps, filling in those gaps, where the gaps are. So I really appreciate your voice today, and joining us for this session, and you also being a woman of color as well. So thank you so much for just joining us. This is very critical and important, to have this discussion. Is there anything you would like to add? I just want to give you a moment if you want to add anything.
Well, I mean, this conversation is one that we continue for a while. There's so much to talk about. We can definitely schedule a roundtable. I have a book called Body Beautiful. It'll be available, I think, next week. So I'll send you the link, and we'll keep in contact with that for the ebook. And if anybody wants to get it, it's a guide and a research guide for planning your surgery abroad, how to read quotes, everything that you need. Basically, Surgery 101 will be in there if you're interested, or if you're looking at, how to go about working your surgery by yourself or working with a coordinator. Again, I'm not pushing you to work with anybody. I just want people to have the information. And again, just be around, be supportive, know that, in general, women of color lack the support that we need in so many different areas, and this should not be another one. If you see somebody, if there's somebody in your life that needs some type of support, be encouraging, try to be positive, even if it's just that you're redirecting them to get more information and to be safe. I think that for me is the biggest thing, because I see so many women that don't look for help because they've been criticized, because they're not free to speak.
Yes, that's a big thing. Yeah. Yep.
Just be supportive. Like I always say, you never know what somebody's going through. You never know what somebody needs or how much they have invested in this. Sometimes they're scared and they're afraid to take a step, and they just want you to kind of, have their back and be supportive, and it can make a world of difference. So we're definitely here. I'm so grateful that we were able to partner today. If you need anything, or your girls need anything, another thing I was going to tell you is we can send you over a link that is an affiliate for you for the Deidre Moss stuff. And any girls that come to your page, and gentlemen also, if they're looking for surgery stuff or help or anything like that, we'll get you your own link so people can submit their requests through you. And we can definitely make sure that we keep you involved with their progress and keep you involved with what's happening with people on your side, so that they can have that support that they're comfortable with, but know that they're being, directed to somewhere trusting. And if you need anything, like I said, you guys are more than welcome to reach out to me at any time. My Instagram page has all my information on it. We have a link tree that'll give you all the links to our YouTube channel. Our Instagram pages, my WhatsApp is on 24/7. So if you guys ever want to just text me and ask questions, you're more than welcome. And our services are free of charge. We do not charge for these services at all. Okay.
I'm glad that you're very transparent. I really appreciate your transparency, Miss Cherry. Can I call you Cherry?
Absolutely.
I love that name. That's such a real name. I love that name.
No, but my name is Cherise, but it's very hard to pronounce in Spanish. And so everybody that mispronounces my name pronounces it Cherry.
How do you pronounce it in Spanish?
Huh?
How do you pronounce it in Spanish?
Cherise. But people don't say the last.
They don't get it right?
So no, eventually we just left it at Cherry and stopped complicating my life and correcting people. So it's yeah. I mean, I try to, even now, I was saying to myself, so funny. I was looking at your back, I think it's beautiful. And listen, I do all my videos like this. And I'm like, although this is plastic surgery, I'm not here to sell you. I'm here to talk to you and make sure
you're real. And I love that.
It's because I'm running crazy working for you. If I'm looking some way, but I will always make sure that you're safe, protected, and that you have the information you need.
I love that. I love that about you, Cherry. Autumn Sky is asking if this live is going to be saved. Yeah, it's going to be here. And we'll also provide the links to Ms. Cherry's page as well, Sirena Surgical Services. So yeah, the live will be here for you to view and go back over if you have any questions.
Sounds great.
Yeah. And also the roundtable discussion you have on Sunday, please send me the link. I would love to be a part of whatever you're doing. And maybe have some persons on who would have done the surgery. I know you said you did it and you went back twice. I wanted to ask you why you went back twice, but I don't know.
I did my breast first. Because that was what was bothering me initially, and that was what my budget was allowing. And then a few years later, I decided
Why?
to
You had small boobs?
Well, after breastfeeding and after having cancer and losing weight and everything else, my skin was hanging really bad. So I wanted to fill them up and make them look nice. So that was why I did that. And then with time, a few years later, I was able to go ahead and do some lipo. And that was really elective. It was just kind of one day to another. My friends were talking about it. And I was like, man, I would love to do that. And my friend was just like, yeah, I'm going to this surgeon, look at him. And I was like, he does big booty girls already. I don't got none of that. So she was like, well, look at these other doctors. And that was how I found all the community and all that stuff, and started just kind of dealing with stuff. And as a therapist, as somebody already in healthcare, we have specific standards in the States, and knowing you're going outside of the country, okay, it's going to be different, but it shouldn't be that different, right?
Yeah,
we're still human, and so there's a certain level of stuff that should be streamlined. And I just kind of felt like I can be here, even if it's for a handful of people. We can do this, and definitely. We've been doing it.
And I love that you have a background, because you mentioned in as a therapist, you have that background to deal with those mental, emotional, especially as a woman, as a woman and stuff. You have all these things going on, and I'm sure you're there to talk to the girls and fill them in on different things and what you would have gone through. So I can appreciate that about you. And so we're gonna wrap this up. I'm gonna listen. I don't want to ramble on.
We can keep talking. I know. We can just keep going. Sunday at 3.
Yeah. So we're gonna wrap this up. So. You want to share your page before we close out?
Sure. You guys can find me on Instagram at Sirena Surgical Services. It'll be typed, I'm sure, here with the Zoom information. But you can find me on there, or you can visit our website. It's under construction right now. I know that they're in the process of fixing it because we changed some surgeons and we're adding some services. But you can also visit serenasurgicalservices.com. Or look at us on YouTube, subscribe to our channel and check us out. We're always uploading a lot of videos about education, specific topics. We go into the operating room, we follow our girls' journey, so you can actually see one-on-one what these girls go through, how they feel, mood swings, happy, sad, everything in between. And you'll also be able to stay up to date on what's happening with the book and what's happening with the series that's about to come out. And perhaps they can catch you there.
Congratulations on your book. You're doing some great things.
Thank you.
Congratulations. So I would like to thank our viewers for listening to our talk. I would love to thank our wonderful guest who was so super transparent, Cherry Martinez of Sirena Surgical Services. I would like to thank our viewers, like our page for future notifications of upcoming talks. Comment on our videos so let us know your thoughts and let us know what you want us to talk about. You can also subscribe to our YouTube channel. Can We Talk? Follow us on Instagram, Twitter, using the addresses provided on our page. And remember, let's think, talk, do. Thank you, everyone.
Bye.
Bye.